friends, what's up? Welcome back to Fraction, your personal guide to action for better life. In this session, we are going to talk about the 8 lessons learned from the lockdown, which began on 25th of March 2020 as a result of COVID-19 pandemic. Let's start with this Rabindranath Tagore quote that faith is the bird that feels the light when the dawn is still dark. So let's start with the lesson number 1 that testing is key to controlling the disease. Friends, at the start of the pandemic in March 2020, World Health Organization came up with the slogan test, test, test. But India's Health Research Secretary Dr. Bhargava said that India is applying its own formula of isolate, isolate, and isolate, which unfortunately did not work. And a year later, Dr. Bhargava was seen making frequent appeals to public to come forward and get tested as a social obligation. And friends, this gives us a lesson that we should work in collaboration with the international institutions and to respect their advisories for the best results. And friends, number 2 is that ventilators were overrated and that it was said that India's close to 50,000 ventilators were not enough to cater the needs of its 1.3 billion population. And everybody from car manufacturers to robot makers jumped into ventilator making. However, it was later found that putting the COVID patients on ventilators made them vulnerable to other respiratory infections. And in Delhi, when the patients were stopped being put on ventilators unnecessarily, the death rate came down dramatically, and it was later realized that the unnecessary hype about the ventilators was not true. And the lesson learned is that we should not succumb to misinformation and fake news. And friends, at number 3 is the wonder drug remdesivir, costing around 3,000 rupees for a course in India. This drug was believed to cure the infection of COVID-19, and later on, this costly wonder drug was found to be ineffective. And a steroid, dexamethasone, costing around 10 rupees for a strip of 30 tablets, was found to be more effective as it prevented the patients from the cytokine storm, which is a condition when the COVID patient's immune system collapses, resulting in the instant death. So now we have learned that what works and what doesn't, and this has given our doctors the confidence to treat the patients. And this brings us to number 4, which is that oxygen saves the lives. And friends, it was found that the patients feeling breathlessness, if put on oxygen early, minimizes the damage because of disruption of oxygen supply to their brain. And this was reiterated by the former Health Secretary, Ms. Preeti Sudan, who said that we learned quickly that oxygen is the best treatment, and that is why India has such a good case fatality ratio. And the lesson learned is that to stop worrying and to breathe in oxygen as much as you can. And friends, this brings us to number 5 that there is no substitute to hand hygiene and the masks. You see, initially there was a slogan in India that save the masks for those who need them the most. And the restriction was so much that when certain MPs went on to attend the Rajya Sabha, the chairman of the Rajya Sabha, Mr. Venkaya Naidu, threatened to throw them out of the house. But from there on, the government is using every platform possible to appeal the masses to wear the masks and to follow the social distancing protocols in letter and spirit. And friends, as of now, the vaccine can only offer to lower the intensity of the infection, but not prevent us from contracting it. So the best way to stay safe is to wear your mask religiously. And this brings us to number 6, that lockdown does not break the chain of transmission. Friends, when the lockdown began in March 2020, the goal was to prevent the transmission, but in a short span of time, India was seen scaling all the peaks of COVID, like the number of cases and the number of deaths as compared to other countries of the world, clearly showing that the lockdown does not help in breaking the transmission. And the lesson learned is that the lockdown is not the solution, but a problem in itself, and it badly affects the livelihood of people, and people die more of hunger than of the disease. And friends, it was feared that if the disease spread to rural India, it will be disastrous as there is huge shortage of healthcare facilities. And this was often cited as a reason for abrupt lockdown and not giving the migrant laborers the chance to return home. However, we saw that the two biggest cities in India, Mumbai and Delhi, were the focal points of the pandemic. The rural areas were comparatively less affected due to easier contact tracing due to the presence of large number of ASHA workers, which was not the case in the bigger cities. And the lesson learned is that we should not panic and that the one size fits all solution doesn't always work. And friends, this brings us to number 8, that young people spread the most but suffer the least. And according to a World Health Organization report, it is the younger people who spread the disease most as they do not show any symptoms and are least affected. And it's for young people to take care of. Do gaz duri, mask hai zaruri. And with this, let's wrap up today's session. And friends, if you like the contents of this video, please share it with your friends and hit the subscribe button below to see me again very soon. Cheers, guys.